Hi everyone, welcome back to my channel. My name is nothing but Sarah. Yes, it's me again. I know some of you that are my old subscribers. First of all, I'll say you guys rock. Thank you very much for sticking out with me. Thank you very much for being here. I really do appreciate you guys. I really do. It was so funny because 2 months ago when I went back on my YouTube channel, I was like, I used to have a channel. Let me see what's happening over there. And I see that you guys are still here. 500 and something of you. I know some of you forget that you even subscribe to this channel. Some of you are just like, I know she'll come back one day. At least when she comes back, we're going to say hi. For those of you that are just like, one day, something's going to happen. I know this YouTube channel is going to pop back up. You're right. This YouTube channel is popping back up. Welcome. My name is no other but Sarah. We are back. Some of you are like, okay, Sarah, what happened? Why did you just go AWire? How come we haven't seen you for so long? Well, I remember 2 years ago, for a reason, I was trying to post on my YouTube channel and I got this block message saying that your YouTube channel has been reported. And I was like, reported? For what? And I was just like, oh, good for me. I can go do other things because I was so occupied with a lot of things. Even right now, I am still occupied with a lot of things. I will tell you why I came back. So stay tuned. I'm just telling you the reason why I went AWire, the reason why you haven't seen me for so long. Some people reported. I remember before that report, some people contacted me saying that we should be doing something called sub for sub, meaning that I will subscribe to them, they'll subscribe to me. I didn't really have time, so I just have to say, oh, I'm sorry, guys. I don't think I'm interested. I think that offended them. One. Also, two, under my comment section, I noticed that when I post, NCLEX videos, I get some comments under my videos that says, oh, thank you to this person. They helped me study for NCLEX and they put a phone number and things like that. I believe it's scam. I take those comments out. And I think that also got them offended. So I guess those people in combination kind of reported my channel for a reason. Looking back 2 months ago, I realized that it didn't even take 24 hours. But because I wasn't paying attention to it, honestly, I didn't even look into it because I checked the date that they sent me that I saw the block message. I took a screenshot because I wanted to come so bad and say I was going to show people on YouTube. But later I was like, why do I need to do that? Nobody cares. That's one. And I checked the day that they released my YouTube channel back. I was like, oh, it's not even up to 24 hours. But I wasn't looking. Fast forward, it's 2 years. I went back on YouTube and I checked my video and I was like, oh my God, it's been 2 good years. Honestly, I'm grateful. I hope you guys are doing great. You guys are doing wonderful. For those of you that want me to do sub for sub, please, I am not interested. I can't. I don't have the time. I don't have the energy. I don't have the effort. So please, I am not. Don't contact me for that. And please don't put anything on my YouTube channel that says, Dr. something helped me with my NCLEX exam. No, my channel is not in for that. No. So why am I back? A few true life story. I have people that I help with NCLEX. I help them. It's just few people. It's not a lot of people. I help them study for NCLEX. And now I have new people. And they're like, Sarah, we knew you used to have a YouTube channel. Why didn't you just post this on YouTube so we can go back to it? So we don't keep calling you every time. When you record, just put it on YouTube. Whatever question we have, we'll ask you and just put it on YouTube. And then I was like, that's a good idea. Because the last time, my goal was to buy like some practice questions and bring it on here and do it. But now I have so many resources that I don't even know what to do with them. So I was just like, okay, I'll pick them back up. I'll make a video. I'll put it on YouTube. If people like it, fine, I will continue. If they don't like it, then I will stop and just talk about nursing related topics. So for those of you that are new, welcome. For those of you that want to know what this YouTube channel is all about, the number one thing that this channel is going to be mostly all about is NCLEX. NCLEX study. It doesn't mean that this is your main source to study for NCLEX. Please know that this is not going to be your main source to study for NCLEX. You can use any other source. I just want my channel to be your foundation to study for NCLEX. When I say that, I will explain how NCLEX sets their questions. I have come to realize that most of us, after we graduate from school, all we need to do is, or all what we want to do is just keep doing practice questions, because that's what you're going to hear everybody says. The more practice question you do, the better you become. But remember, that's why a lot of people ended up buying 2 or 3 different NCLEX practice questions. And I know the majority of you don't even go through 20% of those questions, honestly. I don't want you to do that. I don't want you to waste your money on buying 2 main things or 2 main practice questions. No, just buy 1. That's why my channel is going to be your foundation. My channel is going to talk about how NCLEX sets its question, how NCLEX wants you to think, so that when you are doing your practice question, you're thinking NCLEX style. It will also talk about, NCLEX in general, like what to expect, what not to expect. Why don't you need to study your textbook? In my opinion, the way your school set its question is totally different from NCLEX. NCLEX is much easier. Take it from me. NCLEX is much easier compared to your school exam. If you can pass all your school exam and graduate, honestly, you've passed NCLEX. Major thing about my YouTube channel is to make NCLEX look so easy and sound so easy. I will also talk about nursing related topics. I do travel, I do interventional radiology. For those of you that want to ask me what is that, we are going to talk about that on this channel, so stay tuned. I do interventional radiology. I help patients. I advocate for patients. I educate people about a lot of things, mostly uterine fibroid embolization. I do quite a lot of things. So when I tell you that my plate is very full, honestly, it is. And this YouTube will save me from constant messages and constant, Sarah, when are you sending our videos? Sarah, when are we meeting? Because this is what that is all about. This is what that is for. And I think my practice questions and my explanation will help a lot of people. Wherever I cannot go to, or they can call me, at least they can watch me on YouTube and I can answer most of your questions. NCLEX is easy. NCLEX is simple. There's no need for you to be struggling when you're studying for NCLEX. All what you need to know is how to study for NCLEX, is why NCLEX is setting its question the way it's setting it. Let me give you 2 scenarios. Your school exam is all about, did you study the textbook? Did you go in the textbook? Did you see what the textbook is trying to tell you? Do you know some basic things about this particular topic? NCLEX, on the other hand, is all about, do you know life issues? Do you know how to save somebody? I know you've heard that several times. Now, let me explain to you what that means. NCLEX is all about, as a layman person, do you know what to do? When I say layman, I mean a brand new nurse. NCLEX is also all about, as an intermediate nurse, do you know what to do? And the third thing is, as an advanced nurse, do you know what to do? That is all what NCLEX is all about. If you are able to separate your questions that way, honestly, you'll pass NCLEX. You don't need to know what's in your textbook. What is the teaching that you need to teach your patient? What are the things that your patient says that is more concerned to you? Why do you have to question what this patient just said? Just to be sure that you understand exactly what NCLEX is asking you. Patient safety is the number one thing that I want you to keep at the back of your mind when you think of NCLEX. School is different. Not to say your school don't want you to put patient safety, but remember, it is the school. They want you to know a basic thing. That's why it's so rigorous. Curriculum is so rigorous. That's why you keep going back and forth, and they want you to read like 10 chapters for one exam. You're like, how is that possible? Some even 14 chapters. You're like, how is that possible? Yeah, it's impossible. In 2 weeks, how can you study 14 chapters for an exam in 2 weeks? Honestly, we all know that's impossible. We all know that. So because of that, go through your school stuff. So I know some of you will ask me, Sarah, is your channel going to help us with school stuff? I would say partially, because I mostly want to focus on people that are writing NCLEX. I think I have seen too much of heartache when people say, I read my NCLEX the first time and I didn't pass it. First of all, that doesn't determine how great you are going to be as a nurse. That doesn't determine if you're going to fail as a nurse. Absolutely not. In my opinion, I think all what you need to do is to understand what NCLEX is all about. Fine, if you do a lot of questions, you get to a point where you feel like it's becoming repetitive and you've gotten to the point where you're like, oh, I need to do more. And then you feel like what you're studying right now is not helping you. You need to branch out and go bring in something else. No, if you get one specific thing, I don't care what it is. I don't care if it's UWorld, if it's Kaplan. I think there are other ones. You know them all. I'm just saying this to say, I want you to use my channel as a basic foundation before you start studying for NCLEX. There's no rush into NCLEX. If you rush in, you rush out. You will not pass that exam. And if you've done your NCLEX the first time and you didn't pass, honestly, you are one of the wonderful people that I know. A lot of us cannot take heartache, especially when it comes to not passing NCLEX. So I give it to you. And I tell you that you're stronger than you think. You're braver than you think. You're more important. You're going to be a fantastic nurse when you eventually graduate. Honestly, when you pass that exam, you are going to be a phenomenal nurse. I've seen you guys on your unit, and I have friends that when we talk about it, they're like, Sarah, I took my NCLEX twice. I personally know of someone that took NCLEX 3 times. And you're like, I took you but my third time was a charm. And when they go through the way I was explaining to my orienting, they're like, I wish someone had explained to me this way when I was writing my NCLEX. It would have been so much easier. So please join me in starting this whole thing entirely, this whole community, this whole unit. If you would like, please go ahead. Everything on this channel is going to be for free. When I say free, I mean FREE. I am not selling anything to anybody. Don't let anybody sell you anything. If anybody says, I'm going to give you this and you're going to pass NCLEX, honestly, it's all a lie. If you can master the basic of how to answer NCLEX practice questions or NCLEX questions, you'll be fine. There's nowhere they will bring the question from. You'll be like, okay, bring it. I'm fine with it. When you're left with that 50-50 question, what answer is best? Which one is right? That's what this channel is all about. If that's one thing you're looking for, please join my channel, like, share, and subscribe. Tell everybody, tell your family member, tell your friends, tell every single person. If this is your first time of writing NCLEX, I say good luck to you. If this is your second time, I say you're stronger than you are. Challenge yourself. If this is your third time you're writing NCLEX, I tell you, you are the best of us all. No. Final note. I have other things that I want to talk about on this channel. I'll talk about nursing related topics. I'll talk about traveling. I'll talk about day shift versus night shift. I'll talk about so many interesting things. So stay tuned. Even if you're not studying for NCLEX, even if you've passed that, you've been there, done that, there's still so many things for you on this channel for you to look out for. I'll talk to new students. I'll not talk to new grads. I'll talk to student nurses. I'll talk to managers. Yeah, if you are the type like me that sees something and says something and you get burnt out for that, watch out for my YouTube channel. I'll give you a life scenario. I'll tell you the life of a traveler. Honestly, there's so much to learn from my channel. So please stay tuned. So my channel is back for those of you. And if you're a new subscriber, I say thank you for subscribing. I really appreciate you. If you're an old subscriber, you know I love you from the deep down of my heart. You're loved. You're cherished. You're everything to me. So I really appreciate you. Please stay tuned. Tell everyone to please subscribe to my channel. If you have any question, please put it down in the comment section. Let me know what you think. Let me know your thoughts. Let me know how to improve this channel because you're helping me to help you. What am I saying wrong? What am I doing wrong? So please don't report my channel again. Just put it under the comment section. Let's figure it out. Okay. If you're a nurse, I say you rock. You are the bedrock. You are the foundation of healthcare. You're doing so much, and I give it to you. I give it to you. You take all the insults. You shut up even when you wanted to scream. You are like, this doctor. I know. Yeah, calm down. I know. Yeah, take a deep breath. Okay, this is the channel to do all of that. You want to take a deep breath? Is right here. Is on this channel. So put all your questions down in the comment section and I'll be willing to answer every one of them. Under this video, I have a free cheat sheet. And I'm going to start with that. I have a free cheat sheet to help you practice for NCLEX. What I want you to do is to please print out that cheat sheet so that when I say some things, you kind of like understand what I'm talking about. And also, if you have that, there are some specific things on that cheat sheet that will help you when you're studying for your NCLEX, when you're looking at even other people's practice questions. You have like a guide to help you choose your answers better. So please get a copy. I'm not selling it. It's for free. So please go under this comment section or go under the description box. It's going to be one of those two. Grab it and have a copy. Anytime you want to study for NCLEX or you want to do any NCLEX practice questions, just use that cheat sheet and tell me how it's helping you. With that being said, thank you so much, guys. I really do appreciate you. If there's anything that I'm forgetting, honestly, I'm going to say it in my other video. Thanks for tuning into this far. Few things that I've learned in life. Number one thing is that it's never going to be easy. We are not promised that it's going to be easy. Be it life, be it your situation, be it anything you're going through, personal, non-personal, your friendship, your courtship, your relationship. Life is never, ever going to be easy. One thing that we are all promised is that for every hardship, there is, no matter how hard you think it is, no matter how hard you think you're going, no matter how you feel like this is never going to stop, this feels like it just keep going. Trust me, there'll be a time where you look back and you be like, so why was I stressing? Why? I could have just been like, it's okay, everything is gonna be fine. And I'm saying that to let you know, for those of you that are in school, you're going through so much. You're like, oh my God, the exams keep coming. Are we ever going to have a break? Honestly, darling, you'll get there. For those of you that are studying for NCLEX, I told you, the ancestors of NCLEX does not live in your schools. So always remember that is only for a short period of time. You've done the hard work. You have gone through school. You've done the hard work. You've graduated. So there's no stress anymore. Keep it calm. I know it's easier said than done. It's easier to say, oh, it's not that bad. It's not that big of a deal. It is. I understand you want to write your exam and pass one time, but if you don't, what's the worst that could happen? Life, it's life. What's the worst that can happen, honestly? So with that being said, please, everyone, take care of yourself, take care of your loved ones. The world is so sad right now, and people are going through so much in their lives that I'm always appreciative of what's going on in my life. And if this is the only way that I can help you, honestly, I want to help you as much as I can to pass that NCLEX the first time. So please like, share, and subscribe. Tell your family, tell everyone. And from here, it is a bye for now.